Welcome to another Journal Club session. I hope you enjoyed last month's topic that looked at African mothers' perspectives on having a child with cancer. If you missed it, don't worry. You can always access it through the YouTube channel. Are you watching this alone, or have you gathered a group of colleagues to watch it with you? If you are alone today, maybe consider with colleagues next time. You can access a guide how to organize colleagues watching together in the description section below. This month's article is about the use of locally prepared peritoneal dialysis fluid for acute peritoneal dialysis in children and infants in Africa. It was written by McCulloch et al. And published in the journal Peritoneal Dialysis International in 2020. Let's first look at the graphic summary of the article. This graphic breaks down the different sections of the article and provides a visual summary. In this video, we will now unpack each section. If you have a copy of the article with you, you could track the sections of the article as I speak. We start with the introduction that you can find on the first page of the article just below the abstract. Here, it's described how it's well known that dialysis for the management of pediatric acute kidney injury improves mortality in sub-Saharan Africa. It saves lives. Specifically, the Saving Young Lives program promotes the use of peritoneal dialysis for acute kidney injury in lower middle income countries. But the use of expensive commercially manufactured peritoneal dialysis fluid makes peritoneal dialysis unsustainable in some countries, prompting some to rather use the option of cheaper bedside prepared peritoneal dialysis fluid. Some physicians are cautious about using bedside prepared peritoneal dialysis fluid due to the possible increased infection risk from the use of glucose. But one study in Cameroon showed it to be as effective as commercially prepared solutions in terms of patient survival and peritonitis. This led the authors to consider and report on their experiences of using bedside prepared peritoneal dialysis fluid. The aim of this study was to review the experience of using bedside prepared peritoneal dialysis fluids to treat children with acute kidney injury in terms of both safety and efficacy. Therefore, is it safe and does it work? We now move on to the methods section of the article, where the authors explain how they gathered their data. You can find this on the second page of the article, right after the introduction. A retrospective review of patients who received peritoneal dialysis using bedside prepared peritoneal dialysis solutions were conducted. So in other words, they examined the experiences of past patients who had received peritoneal dialysis using this bedside prepared peritoneal dialysis fluid. A full description of how the fluid was prepared is provided by the authors on page 2, column 1 of this article. The fluid used in the study was prepared by a nephrologist in the intensive care unit under sterile conditions immediately prior to use. Nurses were also trained in this technique who regularly perform manual peritoneal dialysis in the intensive care unit. Once cases were identified, folders were retrieved and anonymized information was recorded in a spreadsheet for analysis. Information retrieved include patient demographic details such as gender, age, weight, underlying diagnosis, indication for dialysis, the type of peritoneal dialysis, and records of peritonitis, as defined by the International Society of Peritoneal Dialysis definitions for peritonitis. Moving on to the analysis and results, which can be found on the second page of the article. All data was captured in an Excel spreadsheet and then analyzed by using descriptive statistics. Data was presented in medians, ranges, and percentages. Just to remind you that a median is the middle number in a sorted list of numbers and not the average, and ranges is the area between the upper and the lower limits of a data set. On tables 2 and 3 on page 3 of this article, you will find the indications for peritoneal dialysis and the underlying diagnoses respectively. Column 1 provides details of the types of catheters and the insertion kits used, which were dependent on the age and weight of the child. So what were the results? 49 patients in total were treated with bedside prepared peritoneal dialysis fluid. The duration of peritoneal dialysis was between 1 and 17 days, with a median of 3 days. No long-term or chronic peritoneal dialysis was needed, as patients in this review either recovered completely or died. 37 out of the 49 children, or 75%, received manual peritoneal dialysis, and 12 out of 49, or 25%, received automated peritoneal dialysis. The overall survival rate was 21 out of 49, which is just under half, or 43%. Complications included blockage of the catheter, which accounted for 6 out of the 49 children, insertion into the bladder, which was 1 patient, inadequate clearance, also 1, peritonitis, with 2 out of 49, and pre-existing contaminated peritoneal fluid, which was 1 child, where the child had pus in the abdomen before initiation of peritoneal dialysis. 1 other child had feculent material in the abdomen, suggestive of a perforated bowel. Both of these were unrelated to the procedure. Which brings us to the conclusion. The authors conclude that the use of bedside prepared peritoneal dialysis fluid is relevant in view of the increased interest in treating acute kidney injury with peritoneal dialysis in low-resourced centers. The study showed a low incidence of peritonitis compared to other similar research conducted. The population in the study was young, with a median age of 3 months, and small, with a median age of 4.1 kilograms, which shows that this treatment can be used in small infants. The authors recommend the use of bedside prepared peritoneal dialysis fluid where resources and/or time is limited. We've come to the end of the video now, and so now you need to access the article. The link is in the description box below, or maybe you already have a printed copy. We really encourage you to now read the article in full, recognizing the parts that we have just summarized for you. After you have done that, consider the reflective questions here on this slide. If you were watching with colleagues, discuss your answers between you. Following that, take a moment to think about what you have learned and how you could apply it to improve nursing practice in your setting.